So how do you go about determining what's causing hair loss for your clients? Like, do you look at their genetics or like what kind of things do you examine?
Yes, I first start off with an in-depth scientific consultation form, which does give me an idea of the family history of hair loss. It also gives me a brief medical history, so it helps me to understand if they're on any medications, if they're the presence of any systemic conditions that could be interfering with the hair growth cycle. And so after collecting this information, I then proceed to have a conversation with the client and try to get more details of the timeline on when they first started experiencing their hair loss, and also getting more information on medications or past or previous illnesses, or if they're currently under any forms of stress. Additionally, I take note of nutritional deficiencies that may be present based on diet. And after doing that analysis, I begin with a physical examination of the scalp. I first visually examine it with my naked eye, and then I utilize a trichoscope, also known as an indigo viewer, which will magnify the scalp for me up to 200 times so that I can see if there are the presence of anything externally on the scalp or in the actual hair follicle that can help me to determine or identify what is actually causing the pattern of hair loss or scalp discomfort.
Right, and you can you see scarring when you look through there in that trichoscope and other kinds of problems that can cause the CCCA or the traction alopecia? Can you see it like physically presenting with a certain type of pattern or signs?
Yes. There typically are signs when there is a level of inflammation below the scalp, so I can't see the inflammation that's in the epidermal layer. But what's on the surface of the scalp, typically there's going to be some discoloration. There may be a texture change in the scalp. And so I look for those signs that are characteristic of CCCA. But because I'm not a medical doctor, I don't officially diagnose, but I do work closely with some dermatologists in the LA area so that if I feel like they need the diagnosis, I refer them to the doctor, and the doctor and I work in tandem to make sure that we're providing the best recommendations for that client so that they can get the best results.
I think that's awesome because, when you have hair loss, you have to have kind of somebody advocating for you a little bit and working with your doctor maybe to say, hey, there really is a problem here. So I think that's great to have that combination of trichologist and maybe your doctor or dermatologist working together to help with the hair problems. So what are some things that you've noticed that have helped women with lost hair to regrow their hair?
Depending on the cause of the hair loss, because I typically use homeopathic holistic treatments in salons to create a supportive environment for my clients' hair to grow. So we first, of course, work on the inside. After checking in with their diet and their lifestyle, I'll make recommendations on creating a more alkaline environment systemically to make sure that their major organs are functioning in a way that can create a supportive environment on the inside for hair growth. Our endocrine and immune systems being some of the major or key body systems that contribute to healthy hair growth. So we deal with that area.